Well, there are nowadays many ongoing studies questioning the value of MRD negativity to stop treatment. For example, after a few years of maintenance therapy, I wouldn't place the question before that, only after a few years of maintenance. The results are promising for those studies that have already read out, but there are patients that are progressing early on. Very few, but there are. So I think it is important to predict upfront who are the patients that, despite having a deep and sustained MRD negativity, will be at risk of MRD resurgence and eventually disease progression if treatment is stopped based on that MRD negativity. Now, both the Italian and the Spanish myeloma groups collaborated on this endeavor and reported recently highly reproducible results showing that there are 4 red flags. One is the presence of 2 or more high-risk cytogenetic alterations, an ISS3, the presence of more than 0.01% circulating tumor cells at diagnosis, and a late achievement of MRD negativity. If a patient has 2, 3 or more of these red flags, then probably stopping treatment is not the optimal approach.